I am Dr. Venkatesh, Senior Consultant Neurosurgeon, Sunshine Hospital, Secunderabad. Today I am going to talk about headache and its various manifestations and different types of headaches and what is to be done during an attack of headache and what headaches are potentially serious and what headaches are innocuous. So, headache is a symptom which every person sometime or other in his lifetime will face. Every person gets headache. There is nobody who is exempt from getting a headache. So headaches can come at different intervals, at different times of the day, at different ages and different parts of the head. So headache can be classified as headache which is arising from within the head and headache which is coming from outside the head. So within the head means brain and its surrounding structures, and outside the head means face and facial structures, and ear, nose, throat and even the eyes. So those headaches which are coming from extracranial or outside the head, that is, for example, people who are having eyesight defects, problems like with eyesight, like myopia, that is nearsightedness, or people who are having eye strain, who are working continuously on some monitors or doing a very delicate job for long hours like jewelers. So these kind of people, because of continuous strain of the eyes, sometimes they can get headache. Similarly, people who are having, everybody has this experience that when we have a cold, we get headache. So cold, cough can also induce headache, and because it will prevent, rather it will do the infection to the sinuses, and sinuses are other extracranial parts outside the brain and outside the skull, which can cause headache. And then we have earaches can cause headaches, toothaches can cause headaches. Actually, the primary problem will be the earache, but actually that will produce a secondary headache, and a toothache can also induce a headache. So these are all the extracranial or outside the head area which can cause a headache. These are not very dangerous. Most of the time these can be treated with simple medication or rest. And those headaches which are coming from the cranial part or the head proper is, for example, like you can have a headache which is coming from one half of the head, or it can be what is called as a holocranial headache. The whole head will be having a headache. Sometimes they can have only the occipital headache or at the back of the head. Sometimes they can have only temporal headache at the temples. So there are different areas of the head where you can get the headache. So temporal headache, then we can also call this as frontal headache. Hemicranial headache is half of the head, holocranial full of the head, back of the head is occipital headache. Now most of the headaches, 98% of the headaches are innocuous. They are not dangerous. They are benign headaches. They just come and go. Every person has this experience. But there are some headaches which are really serious. So these red flags means whenever these kind of symptoms are there, we have to meet a doctor very urgently. Now what are these? Anybody who is more than an age of 50 years getting a severe headache should consult a doctor immediately. Not to say that less than 50 years you should not consult, but 50 years and above, somebody is getting a headache and that should be a red flag. Immediately they should meet a doctor, because it could be a headache because of hypertension. Maybe the person was not knowing that he is hypertensive, or it could be because of some evolving stroke, or there can be a small brain hemorrhage which is caused by headache. These things can happen. The second very important thing is lifetime's most severe headache. Here, this headache is very, very severe. No, the person has never experienced this kind of headache. Along with that, he may have a neck pain. Sometimes he may have vomitings, and he'll have photophobia, means he's not able to see the lights. He'll have to keep his eyes closed all the time. So, and he is very much agitated. It's a very severe headache. This is because of subarachnoid hemorrhage. Means there is a small blood leakage from an abnormal vessel in the brain, which will cause this blood to come out into the surrounding area of the brain. It's also called a subarachnoid space, which induces a severe headache. This could be potentially life-threatening sometimes, and therefore, when this kind of headache comes, you have to meet a doctor immediately. Third is early morning occipital headache. Every day the person is getting headache at the back of the head, and so this could be the first sign of hypertension. So during the day he may not be having that problem, but early morning he may get it. This is the first sign of occipital headache, the first sign of hypertension. So you have to meet a doctor urgently. Now, apart from this, other headaches, like whenever there's a headache with vomitings, or any headache for more than 2 years continuously every day he is getting, or a headache which he is getting once in a while suddenly has become very continuous and it has become more in severity, sometimes in its quality. Sometimes it could be a normal dull aching headache can become a throbbing headache. Then also you have to meet the doctors immediately. Now, having said this, these red flags, what I have listed about 7 or 8, these headaches are very, very rare. This kind of headaches, and fortunately they are very rare because they are life threatening. But anybody who is suffering from headache for more than 2 years, a scan is a mandatory thing, and a consultation with a doctor is mandatory, either a neurologist or a neurosurgeon or maybe a physician, anybody who can just get a scan done and we can see what is the problem. Now, these are all serious headaches. But there are some routine headaches which come, which are not really that life-threatening, but they are really troubling the person very much. Of these, very common is migraine. Migraine is very common. Very common is among the headache syndromes. Migraine is very common. Maybe it's about 1 to 2% of the population, general population, gets this migraine headaches. And why this migraine is important and why it causes so much problem is because they are a chronic headache. They'll go on for years sometimes. And this headache, most of the time, it will cripple the person from not doing anything, any work, and his productivity will decrease because he has to just go and lie down and he cannot concentrate. He cannot do any job properly. So that's why these headaches become more and more important, and especially these can affect even youngsters, sometimes children. So that's why we have to be very wary of this problem. We should be aware of this problem because migraine has excellent treatment, both pharmacotherapy, that is medication, as well as other things like you have to find out the trigger which is causing the headache. Like for example, somebody eats an ice cream, he gets a headache. Somebody goes in the rain, he gets a headache. Somebody goes in the sun, they get a headache. So these kind of triggers, if you know, then you can avoid those and you will not get a headache. And those are the things. Second thing is sometimes these headaches come and they will be very severe. They can cripple the person for a few days sometimes. So in such patients, what is called a prophylactic medicines we give, means we give medicines not to get the headache, rather to prevent the headache. This is prophylactic medicines we give. And whenever there is an attack of headache, we give what is called an abortive treatment, means we give the headache medicine when they get the headache. So they will be taking continuously medicines to prevent the headaches, and as and when they get a headache, they take an abortive medicine also. So that way migraine can be treated. Then there is something called a tension type headache. Tension type headache is what they get at the temples. There is a lot of tension in the muscles, the temporalis muscles, and these patients can also have very good prognosis, means they can be treated well with medicines. And all the patients with headaches, usually they should have a good amount of hydration, very important. Many people, they don't take food or water because they're getting headache, they're not able to concentrate, they just go and lie down. But actually that is going to cause more headache. So you have to keep them well hydrated, you have to give them adequate amounts of water and fluids, and then of course the medication. Apart from these two very common headaches, that is tension type headache and migraine, we also have a variant of migraine called cluster headache, which comes early in the mornings. Just a person gets up from sleep with a reddened eye, watering from the eye one side, and these patients actually develop this headache because they're sleeping in a closed environment without adequate ventilation, so they don't get fresh air into the room. So that will build up the carbon dioxide levels in the blood, and that will cause severe headache. So for them the treatment is simple. They just get up and go out into the open air and take 10 good breaths, long breaths. They will get a good relief. In fact, one of the treatments for cluster headache is oxygen therapy. We give them oxygen and it will relieve the headache. Apart from these, there are still even more there are headaches which are very rare, like some headaches called temporal arteritis, where the headache is coming, and along with that they'll have visual obscurations. They'll have sometimes all the blood vessels which are supplying in and around the eyeball, they all go into spasm, and they cause headache. At the same time, they will cause sudden, partial or temporary blindness. So these kind of things, of course, whenever the person gets, he has to meet a doctor who can diagnose this condition, because your temporal arteritis has got a very good prognosis by giving good medicines like steroids.